My name is Tomas Kalincik and I work at the University of Melbourne Clinical Outcomes Research Unit and the Royal Melbourne Hospital, the Neuroimmunology Centre. So apart from loving research in clinical neurology, I spend a lot of my time climbing rock faces. I'm an avid rock climber, and I'm lucky enough to be able to do that with my family, including my kids. Multiple sclerosis is a complex disease with a lot of activity happening in clinics, and a lot of that activity often goes unrecorded. That requires sometimes sophisticated approaches to design and to analytics. And that overlap, that intersection between analytics and clinical practice is really what caught my attention and that I find stimulating in finding answers from what we do in everyday life. Certainly the number of therapies that we have at our disposal, especially here in Australia, that we can access for people with multiple sclerosis and their families and carers with very little restriction compared to the rest of the world, has been a fantastic evolution. Recently, there has been new emerging information in research in multiple sclerosis about potential etiology of multiple sclerosis or important factors such as EBV virus implication, and that in concert with other information about other factors that can be contributing to the risk of MS may push us closer to understanding not only what causes MS, but potentially how to prevent it in the future. In this research project, MS Australia has supported a proposal in which we will utilize observational data collected from 6 highly specialized centers treating multiple sclerosis with access to HSCT or stem cell transplant, as it is commonly known. We will combine this data with observational dataset, MS-based registry, the largest MS registry in the world. The purpose of this research to explore how HSCT or stem cell transplantation compares to other more commonly used therapies in multiple sclerosis, whether it is a highly potent or even more potent approach than the therapies that we currently use, how safe it is, and to understand in what situation we should be using these treatments. In other words, who is the right person to receive this therapy and at what time. The results of the research that we will pursue will help us understand in what situations which we should be offering people with multiple sclerosis stem cell therapy or chemotherapy with stem cell salvage treatment as a therapeutic option to control their disease. And in particular, it will help us understand what disease forms, whether relapsing or even progressive disease forms respond to these treatments, and individually, who are the right individuals to receive the therapy, and also what are the right conditioning regimens, in other words, treatment protocols used in the application of HSCT. My great pleasure is to work with a fantastic team. This is a team that spans multiple areas, ranging from clinical work in providing care for patients and their carers, the research based and centered around data analytics, data acquisition, and overarching or bridging to laboratory research in neuroimmunology and myelin health. All this research and its communication to the public, the stakeholders, people who support MS and people living in MS is something that I find a fantastic package to be a part of.